Good evening. This is All India Radio. I am Valsa Williams and with me is Manoj Singh Rana with the evening news. The headlines. Prime Minister Narendra Modi participates in the meeting of European Council as a special invitee, discusses COVID-19 pandemic healthcare cooperation and strengthening of Indo-EU partnership. EU members welcome India's efforts to produce and distribute COVID-19 vaccines to over 90 countries. DCGI gives emergency approval to anti-COVID oral drug developed by DRDO. Health Ministry revises national policy for admission of patients to various categories of COVID facilities. Supreme Court sets up 12-member national task force to streamline oxygen allocation across the country. Railways deliver nearly 3,400 tons of liquid medical oxygen to various states so far. Toll fee for tankers and containers carrying medical oxygen exempted across national highways. Government allows hospitals, nursing homes to accept cash payments of over 2 lakh rupees for COVID-19 treatment. No new COVID cases reported in 180 districts in the country in the last 7 days, says Union Health Minister. Over 16 crore 73 lakh vaccine doses administered to beneficiaries in the country. And BJP central leaders hold meeting with Sarbananda Sonowal and Himanta Biswa Sarma to discuss leadership issue in Assam. As the number of COVID cases is on the rise, we appeal to our listeners to take all precautions and all those above 18 years of age to get vaccinated without any hesitation. The vaccination for persons aged between 18 and 44 has begun at designated facilities. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain the Gaz ki Duri for social distancing, focus on hand and face hygiene. And now the news in detail. India and the leaders of the European Union, EU and its member states today highlighted their shared interests, principles and values of democracy, freedom, rule of law and respect for human rights in a joint statement released after the meeting of Prime Minister Narendra Modi and the EU leaders. The leaders met in hybrid format in Porto, Portugal today, where Mr. Modi participated through virtual medium. Briefing media in New Delhi, Secretary West in the Ministry of External Affairs Vikas Swarup informed that today's leaders' meeting reflected a pivotal moment since the first India-EU summit in 2000 and further strengthened the Indo-EU relationship towards a better future for everyone. He said the leaders agreed to advance the implementation of the actions set out in the India-EU Roadmap 2025 as well as of the new decisions taken today. Over the issue of COVID-19, Mr. Vikas Swarup informed that the leaders agreed to defeat the COVID-19 pandemic through global cooperation.
Each and every leader who spoke today underlined the need for greater cooperation between India and the EU for ensuring vaccine production, including a proposal from one of the EU leaders for a partnership with India in the Indo-Pacific for ensuring vaccine access. As I have already mentioned, Prime Minister invited the European Union to support the TRIPS waiver, which we have put forward together with South Africa so that there can be equitable vaccine access for the entire world. And as the US has already supported it, we will be watching the evolving EU position on this particular issue.
India and the EU supported universal, safe, equitable and affordable access to COVID-19 vaccines, diagnostics and treatments and the strengthening of health systems and acknowledged the key role of the Access to COVID-19 Tools Accelerator in this regard. The EU members welcomed India's efforts to produce and distribute COVID-19 vaccines to over 90 countries through its vaccine Maitri. India appreciated the EU's and its member states' quick support and assistance, coordinated through the EU Civil Protection Mechanism, keeping the spirit of solidarity and cooperation that has been the hallmark of India-EU relations. Both India and EU agreed that as the world's 2 largest democracies, they have a common interest in ensuring security, prosperity and sustainable development in a multipolar world. The leaders emphasized the importance of effective and inclusive rules-based multilateralism for tackling current and future global challenges. In the meeting, both India and the EU acknowledged the difficult circumstances caused globally by the pandemic. The leaders deeply condoled the loss of lives and expressed the deepest sympathy with the families of the victims of this pandemic in India, Europe and the rest of the world.
In a major breakthrough against the coronavirus infection, a drug developed by the Defence Research and Development Organisation DRDO got approval for emergency use by the Drugs Controller General of India DCGI. Amid the second wave of the COVID-19 pandemic, this drug will prove beneficial for patients suffering from COVID-19. The drug 2-deoxy-D-glucose comes in powder form in a sachet, which needs to be taken orally by dissolving it in water. It accumulates in the virus-infected cells and prevents virus growth by stopping viral synthesis and energy production. Its selective accumulation in virally infected cells makes this drug unique. The drug has been developed by one of the DRDO labs, the Institute of Nuclear Medicine and Allied Sciences, INMAS, in collaboration with Dr. Reddy's laboratories. Results of clinical trials have shown that this molecule helps in faster recovery of hospitalized patients and reduces supplemental oxygen dependence. Speaking exclusively to AIR News, Director General Life Sciences at the DRDO headquarters, Dr. Ajay Kumar Singh, said that supplementary oxygen dependency of COVID patients decreased significantly after usage of 2-deoxy-D-glucose, and it also reduced their duration of hospitalization.
2DG क्या करता है, जब हम इसको एक कोरोना के मरीज में दे देते हैं तो ये 2DG उस कोशिका में जो कि वायरस से ग्रस्त है उसमें एक तो ये ज्यादा मात्रा में उसके अंदर चला जाता है और दूसरा जब ये ज्यादा अंदर चला जाता है मगर ये ग्लूकोज का वेरिएंट है, ये चला तो जाता है पर ये एनर्जी नहीं दे पाता। तो जब एनर्जी नहीं दे पाता तो वो सेल जो है एक तरह से एनर्जी के लिए भूखा हो जाता है, उसको एनर्जी की जरूरत होती है पर 2DG उसमें से एनर्जी नहीं दे पाता। तो वो डबल मार होती है कि उसने ज्यादा भी ले लिया सेल ने और वो उसमें एनर्जी नहीं दे पा रहा। तो उससे क्या होता है कि जो वायरस है वो मल्टीप्लाई नहीं कर पाता। जब वायरस ज्यादा मल्टीप्लाई नहीं कर पाता तो अल्टीमेटली जो वायरल लोड है वो बॉडी में कम हो जाता है और एक तरह से ये उस वायरस को मारने में या उसकी ग्रोथ को बहुत ज्यादा कंट्रोल करने में कारगर साबित होता है।
The Health Ministry has revised the national policy for admission of COVID patients to various categories of COVID facilities. This patient-centric measure aims to ensure prompt, effective and comprehensive treatment of patients suffering from COVID-19. As per the same directive to all states and union territories, requirement of a positive test for COVID-19 virus is not mandatory for admission to a COVID health facility. No patient will be refused services on any count. This includes medications such as oxygen or essential drugs, even if the patient belongs to a different city. No patient shall be refused admission on the ground that they are not able to produce a valid identity card that does not belong to the city where the hospital is located. Admissions to hospital must be based on need. It should be ensured that beds are not occupied by persons who do not need hospitalization. Further, the discharge should be strictly in accordance with the revised discharge policy. The Railways has delivered nearly 3,400 tons of liquid medical oxygen to various states across the country. The Railway Ministry said 54 oxygen expresses have already completed their journey so far. It said Railways is continuing its journey of bringing relief by delivering oxygen to various states. Presently, 26 tankers are on the run with 417 tons of liquid medical oxygen, which are expected to arrive in Maharashtra, Uttar Pradesh, Haryana and Delhi. The ministry said Railways has so far delivered 230 tons of liquid medical oxygen to Maharashtra, 968 tons to Uttar Pradesh, 249 tons to Madhya Pradesh, 1,427 tons to Delhi, 355 tons to Haryana, 123 tons to Telangana and 40 tons in Rajasthan.
The government has said isolation coaches have been deployed at 17 railway stations for COVID patients in 7 states of the country. The Railways Ministry said at present 298 coaches have been handed over to various states for COVID care with a bed capacity of more than 4,700 beds. The Railways has made provision of 2 oxygen cylinders and fire extinguishers in each coach to meet emergencies. The Railways has deployed 75 COVID care coaches in Delhi, 60 coaches in Maharashtra, 50 coaches in Uttar Pradesh, 42 coaches in Madhya Pradesh, 21 isolation coaches in Guwahati, Assam, and 20 isolation coaches in Badarpur near Silchar. The ministry said the Railways has made available a fleet of more than 4,400 isolation coaches with around 70,000 beds to serve as isolation units. The Supreme Court today constituted a 12-member task force to assess availability and distribution of medical oxygen on scientific, rational and equitable basis across the country. The task force will also suggest measures to ensure availability of medicines needed to treat COVID-19. A bench of Justices D.Y. Chandrachud and M.R. Shah said the rationale for constituting the task force at the national level is to facilitate a public health response to the pandemic based on scientific and specialized domain knowledge. The task force will consist of leading experts from across the country as members and resource persons.
The toll fee for tankers and containers carrying liquid medical oxygen has been exempted across national highways. Keeping in view the current unprecedented demand of the medical oxygen across the country due to the COVID-19 pandemic, the containers carrying oxygen will be treated at par with other emergency vehicles such as ambulances for a period of 2 months or till further orders. The National Highway Authority of India, NHAI, has said the toll plazas have nearly zero waiting time after implementation of FASTag. It said NHAI is already providing priority passage to such vehicles for quick and seamless transportation of medical oxygen. The authority has issued instructions to all its officials and other stakeholders to assist the government and private efforts to fight the pandemic in helping and proactive manner. The Ayush Ministry has launched a massive nationwide campaign to distribute its polyherbal Ayurvedic drugs Ayush 64 and Kabasura Kudinir to the majority of out-of-hospital COVID-19 patients. In a media statement, the ministry has said the efficacy of these drugs have been proved through robust multi-center clinical trials. Speaking exclusively to AIR News, Chairperson Interdisciplinary Ayush R&D Task Force, Professor Bhushan Patwardhan, said that Ayush 64 has effectively shown to reduce the duration of hospitalization in COVID patients.
Ayush 64 is a polyherbal Ayurvedic formulation that was prepared by Central Council for Research in Ayurvedic Sciences for the treatment of malaria. It comprises of 4 plants. Common names, they are known as Saptavaranga, then Kutaki, Kirayat and Kanta Karanja. These are the 4 plants which are commonly used in Ayurvedic medicine, and the speciality of Ayush 64 is that it is much effective in influenza-like illnesses and diseases like flu with common symptoms including viral fever to reduce duration and early recovery without any side effects. In short, this is a anti-malaria drug getting repurposed now for the treatment of mild to moderate COVID.
The centre has designed a streamlined and systematic mechanism for effective allocation and prompt distribution and delivery of the support supplies received by India in the fight against COVID-19. The Health Ministry said cumulatively 6,608 oxygen concentrators, 3,856 oxygen cylinders, 14 oxygen generation plants, 4,330 ventilators and about 3 lakh remdesivir vials were delivered so far. You're listening to the evening news on All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi participates in the meeting of European Council as a special invitee. Discusses COVID-19 pandemic, healthcare cooperation and strengthening of Indo-EU partnership. EU members welcome India's efforts to produce and distribute COVID-19 vaccines to over 90 countries. DCGI gives emergency approval to anti-COVID oral drug developed by DRDO. Health Ministry devises national policy for admission of COVID patients to various categories of its facilities. Supreme Court sets up 12-member national task force to streamline oxygen allocation across the country. Railways deliver nearly 3,400 tons of liquid medical oxygen to various states so far. Toll fee for tankers and containers carrying medical oxygen exempted across national highways. Government allows hospitals, nursing homes to accept cash payments of over 2 lakh rupees for COVID treatment. No new COVID cases reported in 180 districts in the country in the last 7 days, says Union Health Minister. Over 16 crore 73 lakh vaccine doses administered to beneficiaries in the country. And BJP central leaders hold meeting with Sarbanand Sonowal and Himanta Biswa Sarma to discuss leadership issue in Assam. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
चलो मिलकर एक शुरुआत करें, चलो एक फैसला आज करें, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे, चलो एक इरादा करते हैं, चलो कुछ वादा करते हैं, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे.
Welcome back to the evening news. Health and Family Welfare Minister Dr. Harshvardhan has said that 180 districts in the country have not seen a single coronavirus case in the last 7 days. He said only 0.39% patients are on ventilator support and 3.7% are on oxygen-supported beds. The Health Minister today chaired the 25th Group of Ministers meeting on COVID-19. During the meeting, steps to ensure adequate availability of oxygen, therapeutics, diagnostics and medical equipment were reviewed. External Affairs Minister Dr. S. Jaishankar, Civil Aviation Minister Hardeep Singh Puri, Minister of State for Chemicals and Fertilizers Mansukh Mandavia, Minister of State for Home Affairs Nityanand Rai and other officials took part. The country registered over 4 lakh new COVID cases in the last 24 hours. The Health and Family Welfare Ministry today said the active cases are continuously rising in the country due to a spike in cases in several states and union territories. The ministry has said that there are over 37,23,000 active cases in the country at present, which comprises 17% of the total positive cases. It said a total of 4,187 deaths have been reported in the country within 24 hours, taking the toll to over 2,38,000 across the country. The Health Ministry said over 3,18,000 patients have recovered from this infectious disease within 24 hours. So far, over 1 crore 79 lakh patients have recovered from the disease. However, with the rising number of fresh cases, the recovery rate has declined to 81.9%.
Over 16 crore 73 lakh COVID vaccine doses have been administered to beneficiaries in the country so far. The Health and Family Welfare Ministry said that over 22 lakh 97,000 doses have been administered to beneficiaries within 24 hours in the country. Addressing the media, Union Health Minister Harshvardhan said that the vaccination drive in the country is going smoothly.
Yesterday night, as per the data compiled in the morning, we have been able to administer 16 crore 73 lakh 46,544 doses to our countrymen in the various priority groups. In the health workers category, 95 lakh 22,639 health workers have got the first dose and 64 lakh 30,277 health workers got the second dose.
The Union Government has provided over 17 crore 49 lakh vaccine doses free of cost to states and union territories so far. Of this, the total consumption of doses, including wastages, is over 16 crore 65 lakh. The Health and Family Welfare Ministry said that more than 84 lakh vaccine doses are still available with the states and union territories. The ministry has assured that more than 53 lakh 25,000 vaccine doses will be provided to states and union territories within the next 3 days. The Health Ministry has said vaccination is a crucial pillar in the fight against the coronavirus, and the third phase of COVID-19 vaccination has already started in the country.
In view of COVID-19, the government has relaxed the provisions of the Income Tax Act. Now, all hospitals, nursing units, dispensaries and COVID care centres will be able to accept cash over 2 lakh rupees from the patients. Patient and the payee will have to submit PAN and Aadhaar for such payments. The relaxation has been granted between the 1st of April to the 31st of May this year. In the Union Territory of Jammu and Kashmir, 4,788 new COVID-19 cases were reported today. Out of these cases, 1,529 cases were reported from Jammu Division, while 3,259 were reported from Kashmir Division. Besides, 60 COVID deaths were reported in Jammu and Kashmir, with 42 fatalities from Jammu Division and 18 from Kashmir Division.
A total of 17,364 new confirmed cases of coronavirus infection were reported in the national capital during the last 24 hours, taking the total number of cases to over 13,10,000. The Delhi government said that over 12 lakh people affected with coronavirus have been cured so far. In the last 24 hours, 20,160 people have recovered and 332 deaths were reported in the city. Uttar Pradesh Chief Minister Yogi Adityanath today said that every person in the state who is above 18 years old will get vaccine, and from coming Monday, the vaccination drive will be launched in 18 municipal corporations of the state and Gautam Buddha Nagar along with the present 7 districts. More from our Lucknow correspondent.
Till date, more than 1 lakh beneficiaries have been administered the COVID vaccine who are between age of 18 and 44. On the other hand, number of COVID cases are also decreasing in the state. In last 24 hours, around 34,000 patients have recovered from this deadly virus, while around 26,000 new cases were found. Meanwhile, after recovering successfully from the COVID infection, Chief Minister Yogi Adityanath today visited Bareilly and Moradabad districts and reviewed the COVID preparations and other healthcare arrangements. In a surprise visit, Chief Minister visited the villages of both districts and interacted with those patients who are COVID infected. He asked whether they are getting medicines and health department is taking care of them or not. Sushil Chandra Tiwari, AIR News, Lucknow.
With the health machinery under tremendous pressure due to persistent rise in COVID cases in Pune, the Maratha Chamber of Commerce, Industries and Agriculture MCCIA has come up with Mission Vayu. The MCCIA has set up a Pune platform for COVID-19 PPCR response, which comprises more than 250 private and government hospitals. More in this report from our Mumbai correspondent.
With the rise in demand for oxygen and ventilators, the Pune platform for COVID-19 response of the Maratha Chamber of Commerce, Industries and Agriculture has arranged for procurement and donation of 250 BiPAPs and 4,000 oxygen concentrators for the worst affected areas in the district and in 10 most affected districts, which include Ahmednagar, Bhandara, Latur among others. Mr. Prashant Girbane, Director General of MCCIA, said Mission Vayu is also supported by Amazon as logistics partners. Recently, a consignment of around 250 ventilators and 4,000 oxygen concentrator units were brought from Singapore to Pune. Apart from this, PPCR has set up 12 oxygen generator plants that are now being set up at multiple government and private hospitals. Kunal Shinde, AIR News, Mumbai.
The West Bengal government has issued new guidelines regarding cremation of those who died due to COVID. The bodies of the deceased will now be allowed to be handed over to the families from the hospitals on condition that those will not be taken to their homes and to be cremated somewhere in the vicinity of that area. Concerned government officials are required to be intimated about the arrangement of the funeral, which is to be done in accordance with COVID rules. Kerala continues to report a surge in COVID cases as it confirmed 41,971 new infections. Today, the state is presently under complete lockdown till May the 16th. More from our Thiruvananthapuram correspondent.
Chief Minister Pinarayi Vijayan, while addressing the media today, said that people at large are cooperating with the lockdown. He directed the local bodies to be more vigilant in areas with high COVID confirmation rates. Ward-level committees must ensure sufficient ambulance services, essential medical facilities, availability of health and sanitation workers in the region. Meanwhile, as complete lockdown began today, police are strictly carrying out inspection and stringent action across the state. The online facility to apply for emergency travel pass came into effect today evening. The pass can be applied through the website pass.bsafe.kerala.gov.in. Meanwhile, the test positivity rate in Kerala is at alarming 28.25%. Mayush Shah for AIR News from Thiruvananthapuram.
BJP central leaders held a meeting with Assam Chief Minister Sarbanand Sonowal and Senior Minister Himanta Biswa Sarma today to discuss the leadership issue in the new government. The meeting concluded this evening at a party president JP Nadda's residence in the national capital and was attended by Home Minister Amit Shah and BJP General Secretary B.L. Santosh. Speaking to the media after the meet, Assam's caretaker Chief Minister Sarbanand Sonowal said that the BJP Legislative Party meet will take place in Guwahati tomorrow and answers to all questions will come out from that meeting. In the recently held assembly elections, the BJP registered a decisive victory, but the party is yet to take a decision on who the Chief Minister will be in the next government. In Tamil Nadu, the 16th Legislative Assembly has been summoned to meet for the first session on Tuesday at 10 a.m. The assembly will be held at the Kalaivanar Alangam instead of the Assembly Hall at Fort St. George owing to COVID regulations. The newly elected members will take oath on the day. The election of Speaker and Deputy Speaker will be held on 12th of May.
Remnants of China's largest rocket, Long March 5B, launched last week, are expected to plunge back through the atmosphere today, late evening or in the early hours of tomorrow. At 18 tons, it is one of the largest space debris to re-enter the Earth. In a tweet, the U.S. Aerospace Corporation said the latest prediction for the re-entry location of the Long March 5B rocket body by its Centre for Orbital Re-entry and Debris Studies was given near the North Island of New Zealand. However, it noted that re-entry was possible anywhere along paths covering large swathes of the globe. An explosion near a school in the Afghanistan capital Kabul today killed at least 25 people and injured dozens of others. Afghanistan's Interior Ministry spokesman Tariq Aryan said at least 52 people, most of them students, were injured in the blast. However, he did not specify the cause or the target of the explosion. Ghulam Dastagir Nazari, spokesman for the Afghan Health Ministry, said that 46 people had been taken to hospitals so far.
Now let us take a look at the weather forecast for tomorrow. Jammu is likely to have a partly cloudy sky with possibility of rain or thunderstorm. Minimum temperature will be around 21 degrees Celsius while maximum will be around 34. Srinagar will have a partly cloudy sky with possibility of rain or thunderstorm and dust storm. Minimum temperature will be around 10 degrees Celsius and maximum 24. Leh will have a partly cloudy sky. Temperature will be hovering between 6 degrees to 21 degrees Celsius. In Gilgit, the minimum temperature will be around 12 degrees Celsius and the maximum is expected to be around 31 degrees. The region will have a partly cloudy sky. In Muzaffarabad, with temperature shifting from minimum of 15 degrees to maximum 32 degrees Celsius, the sky will be partly cloudy with possibility of rain or thunderstorm. Chandigarh will have a partly cloudy sky with 1 or 2 spells of rains. Temperature will move from minimum of 24 to maximum of 31 degrees Celsius. Dehradun will have a partly cloudy sky with possibility of rain or thunderstorm or dust storm. Temperature will move between minimum of 22 to maximum of 34 degrees Celsius. The national capital Delhi is expected to have a mainly clear sky. Minimum temperature will be around 23 degrees Celsius and maximum is expected to hover around 40 degrees. Mumbai will have a partly cloudy sky. Minimum temperature will be around 27 degrees Celsius and the maximum will be around 37. Chennai will also have a partly cloudy sky with minimum temperature touching 29 degrees Celsius and the maximum expected at 37 degrees. Kolkata will have a partly cloudy sky with possibility of moderate rain or thunderstorm. Minimum temperature in the metropolis will be 25 and the maximum is expected to be 34 degrees.
And now, before we end the bulletin, the headlines once again. Prime Minister Narendra Modi participates in the meeting of European Council as a special invitee, discusses COVID-19 pandemic healthcare cooperation and strengthening of Indo-EU partnership. EU members welcome India's efforts to produce and distribute COVID-19 vaccines to over 90 countries. DCGI gives emergency approval to anti-COVID oral drug developed by DRDO. Health Ministry revises national policy for admission of patients to various categories of COVID facilities. Supreme Court sets up 12-member national task force to streamline oxygen allocation across the country. Railways deliver nearly 3,400 tons of liquid medical oxygen to various states so far. Toll fee for tankers and containers carrying medical oxygen exempted across national highways. Government allows hospitals and nursing homes to accept cash payments of over 2 lakh rupees for COVID-19 treatment. No new COVID cases reported in 180 districts in the country in the last 7 days, says Union Health Minister. Over 16 crore 73 lakh vaccine doses administered to beneficiaries in the country. And BJP central leaders hold meeting with Sarbananda Sonowal and Himanta Biswa Sarma to discuss leadership issue in Assam. And with that, we end the evening news. Good night.